Hello, my name is Leah Crown. I'm the Director of Health and Human Services for the City of Meriden. It is time for our weekly social media question and answer video. As you are aware, COVID-19 is a rapidly changing situation, and the information provided in this video is based on Center for Disease Control guidance, Governor's executive orders, and general disease knowledge as of May 12th, 2020. Thank you all for your questions. So our first one is, how distant is a vaccine? Are we nearing human trials by now? And as soon as a vaccine is produced, how long does it take to get it in the hands of local doctors and administrating personnel? This is a very good question, and I wish I had a better answer for you. As we know, there is currently no vaccine for COVID-19. I do not have an answer regarding a timeline for the vaccine. Efforts are underway to produce a safe, effective vaccine. A recent article by the National Institutes of Health emphasizes that developing COVID-19 vaccines will require unprecedented cooperation from governments, academic institutions, industry, and global philanthropic partners. There is also more research to be done about what constitutes a durable, protective immune response against COVID-19. So the researchers and the scientists are working on a vaccine, but unfortunately I don't have a timeline as to when there will be enough for everyone, and when we as a health department may get some to provide to our community. Number 2, will parents have the option to continue distance learning in the fall? I will have to defer whoever asked this question to the Meriden Board of Education, as ultimately it would be their decision and most likely a governor's executive order. They are working on plans right now for the 2020-2021 school year, so please reach out to the Board of Education for the answer to your question. Number 3, can adults be susceptible to Kawasaki disease? So according to the Centers for Disease Control and Prevention, Kawasaki disease, also known as Kawasaki syndrome, is an acute febrile illness of unknown cause that primarily affects children younger than 5 years of age. Clinical signs of this disease includes fever, rash, swelling of the hands and feet, irritation and redness of the whites of the eyes, swollen lymph glands in the neck, and irritation and inflammation of the mouth, lips, and throat. Estimates indicate at least 3,000 cases of Kawasaki disease are diagnosed each year in the United States. There is no reference of adult infection of this rare illness on the CDC website. If you have concerns, please reach out to your doctor. This fourth question is probably related to number 3. The fourth question is related to children and multi-system failure system. What is Meriden doing to track this? So this is something new that we're seeing and may be related to COVID-19, but this week Yale New Haven Children's Hospital has reported Connecticut's first cases of pediatric multi-system inflammatory syndrome. So the hospital currently has 3 patients diagnosed with the syndrome, again believed to be tied to COVID-19. The hospital has reported all 3 cases to the Connecticut Department of Public Health. If a child in Meriden shows the signs of these symptoms, which include persistent fever, rash, as well as gastrointestinal symptoms such as vomiting and diarrhea, we encourage the parent or guardian of that child to contact their pediatrician immediately. If a child in Meriden is diagnosed with the syndrome, the Department of Public Health will contact our office, and then we will in turn contact the public as appropriate. Number 5, can dogs contract COVID-19 or any animal? So the CDC is aware of a small number of pets worldwide, including cats and dogs, to be infected with the virus that causes COVID-19, mostly after close contact with a person that has had COVID-19. Until we learn more about how this virus affects animals, please treat your pets as you would other human family members to protect them from possible infection. So some tips include: do not let pets interact with people or other animals outside the household. Keep cats indoors when possible to prevent them from interacting with other animals or people. Walk dogs on a leash, maintaining your 6-foot distance from other people and animals. And avoid dog parks or public places where a large number of people and dogs gather. Talk to your veterinarian if your pet gets sick or if you have any concerns about your pet's health. Number 6, when retail stores reopen, will the store associates be protected with protective plexiglass? So according to the governor's retail and mall sector rules for reopening, the use of partitions between employees where a 6-foot distance cannot be maintained, where possible, is recommended. This is on page 9 of the document, which can be found on the Connecticut's COVID-19 webpage. Number 7, can someone be reinfected with COVID? According to the CDC, the immune response, including duration of the immunity to the virus that causes COVID-19 infection, is not yet understood. At this time, we do not know if someone can be reinfected with COVID-19. Everyone should continue to practice social distancing, good hand washing, and other public health prevention messages and efforts. There are many people, this is question number 8. There are many people making masks at home to either sell or give away for free. How would you rate the homemade masks versus the professionally made masks? Is there any advice you can offer regarding these homemade masks? So cloth face coverings that are being made are certainly not the same as medical face masks, surgical masks, or respirators such as N95 respirators. These are worn by healthcare professionals, first responders, and workers in other industries. These masks and respirators are called personal protective equipment. Medical PPE, or that personal protective equipment, should be used by healthcare professionals and first responders for their protection. Cloth masks, certainly for us, are more accessible and reusable for the general public. When using a cloth face covering, please make sure that your mouth and nose are fully covered. The covering fits snugly against the sides of the face so there are no gaps. You do not have any difficulty breathing while wearing the cloth face covering. The cloth face covering can be tied or otherwise secured to prevent slipping. When wearing your mask, please avoid touching your face as much as possible. I know it's very tempting to readjust masks when we have them on, but please don't touch your face. Keep the covering clean. Clean hands with soap and water, or use a waterless hand sanitizer immediately before putting on your mask, after touching or adjusting your mask, and after removing the cloth face covering. Do not share your cloth face covering with others unless it's washed and dried first. You should be the only person handling your covering. Laundry instructions for your covering will depend on the cloth used to make your face covering. In general, cloth face coverings should be washed regularly, such as daily or whenever they are soiled, using water and a mild detergent, dried completely in a hot dryer, and stored in a clean container or paper bag. Please note that wearing a cloth face mask will lose any value unless it's combined with frequent hand washing and social distancing. So those are all of the questions we received this week. Please keep them coming. And as always, you can reach out to your local health department. We can be reached at 203-630-4226 if you have any additional questions. Thank you very much.